The reforms I'm proposing would not apply to those who are here illegally. It's not true.
Remember that moment? South Carolina Republican Congressman Joe Wilson shouting out at the president during his remarks on health care. Well, that congressman, who was forced to apologize to the White House after he interrupted the president's speech by yelling, "You lie," now says he has been vindicated. At the time, he was responding to the president's claims that illegal immigrants would not be covered by the president's health care plan. Well, now we are learning that millions of health care dollars are being set aside for migrant and farm workers, but those medical centers are not going to be allowed to ask about immigration status. Congressman Wilson says it is inevitable that some of that money will be used to serve illegal immigrants. Joining me now to discuss it, Francisco Hernandez, who's an immigration attorney, and Dan Stein, who is the president of the Federation for American Immigration Reform. Gentlemen, thanks for being here. Dan, let me start with you. Congressman Wilson basically says this vindicates his charge that the president was misleading the American people when he said that the health care reform bill would not, now law, would not cover illegals. Does he have a point?
Joe Wilson was always correct. He was always correct, Megan. Now, he apologized because he violated the House rules on decorum, but he was never apologizing for the merits of what he said, which is that under the president's plan as originally proposed, and certainly under these community block grants, illegal aliens will be getting taxpayer-subsidized health care. Farm communities, farm employers continue to have we taxpayers subsidizing their use of illegal alien labor. And under these block grants, these centers simply won't ask. And that was always the big issue with Joe Wilson and everybody working on health care. Are we going to continue this don't ask, don't tell policy whereby illegal aliens continue to get taxpayer-funded health care? And the answer is it's still going on.
Francisco, you know, apparently they're going to get $8.5 million that will be used to target services to migrant and seasonal farm workers. That's according to the government. That they admit that they will not be checking immigration status, and it is a well-known fact that a large portion of migrant workers may be illegals or are typically made up of illegal immigrants. So how does it not then follow that we will be paying taxpayer dollars to pay for illegal immigrants' health care?
Well, first of all, we have to, the issue that we're here about is you can't vindicate bad manners. Congressman Wilson was chastised for bad manners and bad decorum and breaching protocol and being insultive to the president.
But substantively, the question is, was he right?
Okay. Well, the problem is that substantively, he doesn't know. He's going on an assumption now. By virtue of being labeled migrant farm workers, they have to have a temporary work visa, a farm worker visa. So we don't even know whether they are or how many there are.
Well,
so
the Pew Hispanic Center, the Pew Hispanic Center estimates that about a quarter of them are undocumented. About a quarter.
Well, but it also says that they're going to be paying for their own services of primary care.
But they can't turn anyone away.
Whether they're asked or not.
But they can't turn anyone away. They can't turn anyone away. Dan, what they say is that the law requires these health centers to not turn anybody away if they have the inability to pay. They will try to get people to pay towards their cost of care, but if they can't turn them away. So who's paying for it, Dan?
But every public hospital has that obligation.
If you order a cheese pizza at a pizza parlor, I can't tell you for sure there's going to be cheese in the first bite, but I guarantee you it's coming somewhere along the way. I guarantee you 100%.
The point made is that there will be.
Hold on, let me finish, Francisco. I'll get back to you.
There will be illegal aliens getting health care under this grant, under these grants. We also know that the Obama administration has done nothing, zero, to try to improve the verification systems that are available to keep illegal aliens from getting our taxpayer-funded benefits.
Can you speak to that point, Francisco? Because according to the government, to the feds, the program's authorizing statute that's giving them all this money does not affirmatively address immigration status, and that's the problem. It doesn't really tell these healthcare centers, asking we're not providing taxpayer-funded health care to the illegal immigrants.
Well, but the law itself doesn't provide for giving primary health care to undocumented workers. So the question is, does the law? He's saying, Congressman Wilson is saying that I was right, that the law does allow it, and it still doesn't allow it. The question of how you get to who's getting it is a much deeper question that they can get to. Why doesn't Congressman Wilson pass a law that says that they have to ask? I mean, start moving.
Well, that was the
broader question.
Guys, I got to run because we're out of time.
But if it doesn't specifically prohibit it, then it's allowing it. That's the point.
Okay, got to go. Thank you both.
No, it doesn't. It specifically prohibits it.
Thank you both. I appreciate it. Got to run. My apologies. All the best. So what is Congress?